Anemia is a condition where one's hemoglobin concentration is below the reference interval for the age and then the sex of an individual. The age and then the sex is very, very important. Underline. Yes, so anemia is not a disease on its own. No, it is not a disease on its own, but rather is the manifestation of a disease. So let's look at the causes of anemia. What are all causes one to be anemic? When there is increased destruction of red blood cells, that is when the number of red blood cells destroyed exceeds the number of red blood cells produced. Okay, so what condition at all can destroy red blood cells? Okay, conditions or diseases like malaria. What malaria parasite does to the red blood cell is that they feed on the red blood cells. And so if you have a severe malaria, it is possible that your hemoglobin content will be low because the parasites will feed on your red blood cell. Also, when you are a sickle cell patient, here the number of required days for your red blood cells is reduced. It's not as the 120 days that we know. So your red blood cells destroys earlier than it is supposed to be. And so if your body or your system is not able to produce enough red blood cell to recompensate that destruction, then it can lead to anemia. And then we have G6PD deficiency. When you are G6PD defect, there are some drugs that you do not take. Drugs that contain sulfur. You do not eat fever beans. And then you do not take things that contains camphor. If you take these in your system, what it does to your system is that it breaks your red blood cells. Yes, it destroys your red blood cells. And so if your system or your body is not able to produce to recompensate the destruction, it can lead you to anemia. Another cause of anemia is excessive blood loss. And then when also there is less red blood cell production, if the bone marrow, which is responsible for producing red blood cells or producing all the types of blood cells, is impaired or there is something wrong with it, then it's not able to produce the required number of red blood cells. It can lead one to this condition called anemia. Okay, so I made mention of reference range in terms of age and then sex. Let's take this into consideration. An adult female HB or hemoglobin concentration is 12 to 16 gram per deciliter. Others measure it in gram per liter, and so when it is in gram per liter, it may differ from when it is in gram per deciliter. So for adult males, their hemoglobin reference range is from 13 gram per deciliter to 18 gram per deciliter. Babies have a lot of hemoglobin content more than females adults and then males adults. Yes, children between 0 to 1 month, their hemoglobin reference range is from 13 gram per deciliter up to 20 gram per deciliter. This is because their bone marrow is so fresh and out of fat, and so it's able to produce enough red blood cells or enough blood. So let's look at the types of anemia. We have a lot or many types of anemia, but we are going to concentrate on the basic ones. So we have iron deficiency anemia. Iron forms part of hemoglobin, and then we know that hemoglobin is found within the red blood cells. And so if you don't have enough ions, formation of your hemoglobin, there will be a problem, as well as your red blood cell production. We have aplastic anemia. Aplastic anemia has to do with the bone marrow stem cells that produce your blood cells. If there is impairment in your bone marrow stem cell, it can affect your white blood cells, your red blood cells, your platelets, or the bloodline. And so enough red blood cell wouldn't be produced as it's supposed to be. And so it may lead you into this condition called aplastic anemia. And then we have macrocytic and then microcytic anemia. If your red blood cells sizes is not of the required size, that is 7 to 8 micrometers that we talked about in our previous episodes, it can affect the content of your hemoglobin. Yes, and also if your red blood cells is too big, sometimes it's as a disease condition, and so the required hemoglobin content that your red blood cells are supposed to contain may be deficient. So let's look at the signs and then symptoms of anemia. If I'm anemic, how do I tell? So when you are anemic, you experience dizziness, shortness of breath, you become very fatigued, you have headache, and then in serious cases, heart failure can set in. You remember that in our previous episode, I tried to explain how important the blood is to our system. If you don't have enough blood in your system, it can cause your life. And so if all of a sudden your blood or hemoglobin content reduce drastically, it can cause heart failure or coma. So please, I will entreat each and every one of us all to eat well. Make sure you eat well. Let's sleep in treated mosquito net to prevent mosquito bites. And also, if you are a sickle cell patient, please visit the hospital, a clinic, or see your doctor regularly. It's very important. If you are a GSSPD defects patient, please, what you are asked to abstain from, do well to abstain from, because it's dangerous. I remember one of our lecturer gave an example. Actually, he's a hematologist. Yes, Dr. Intiamwa. He said that there was a time where a case was brought to him. So this woman had gone to a prayer camp, and then she was asked to take a camphor. And then she didn't know that she was GSSPD defective. So this woman took the camphor, and then the crisis set in. She was brought to the hospital, and then at the long round, after the test, everything, she died. She died. So please, your health matters. As I always say, your health matters to me. It matters to your family. It matters to your friends. It matters to the nation. We need you alive. I will entreat us all to subscribe to this channel, like, and then share to others to also get this vital information. See you in our next episode.